Hello, this is TJ and I'm going to be demonstrating IVDC. I'm going to gather my equipment and supplies and make sure this patient for sure needs their IV taken out. I'm going to make sure the name matches with the order. I'm going to use 2 patient identifiers and make sure this IV needs taken out. So I'm going to practice my general principles and safety practices, enter the room with my supplies, and perform hand hygiene. I'm going to inspect this IV site, make sure there's no redness or swelling at the site. It seems to be good right now. It looks good to be taken out. So we're going to begin with that. Looks like the hub is unscrewed, the line is off, hung up, pumps off. And then now I'm going to perform hand hygiene and don some gloves. So I'm gonna slide my gloves on. So I'm gonna grab my gauze and my tape. Set that there. And then I'm gonna be very gentle while trying to take this IV out. I'm gonna roll this tape up and stabilize this IV here. Just roll it up like that. Then I'm gonna take my gauze and apply pressure at the site and pull that IV out. I'm gonna inspect it, make sure it's all intact, make sure there's nothing abnormal with it. And then I'm going to turn around, discard it in the biohazard container. And then if this patient's on blood thinners, you'd expect more blood to come out, and then just check it every once in a while. If they're still bleeding and they're on blood thinners, apply pressure for at least 2 to 5 minutes. So I'm gonna get my tape out here. If I can find the line. Give me 1 second here. All right, find the line where the tape starts. So I'm still applying pressure to that gauze. Then I'm gonna grab me a piece of tape. Make sure that tape secures that piece of gauze there. Rip that tape off. The gauze is covering that site where the IV was. Put the patient back up. I'll doff my gloves, throw the gloves away. Make sure the patient is comfortable and properly positioned, and practice my general principles and safety practices again. I'm gonna perform hand hygiene when leaving the room and record my IVDC.